There are many different types of birth control out in the population and available. The birth control can be separated into two different categories, or actually multiple different categories. You can have the permanent sterilization option, which is basically saying I am either done with my childbearing years or I absolutely never want to have children, and that is absolutely a choice that can be made by each individual. That includes things like vasectomy, which is done for male partners, as well as a salpingectomy, or tying my tubes. That is a common misconception because tying tubes is actually now recommended to take out the entire fallopian tube to reduce the risk for ovarian cancer as well as ectopic pregnancy. But going into that type of birth control should recognize that it is an irreversible procedure. It is meant to be permanent. Outside of that, we kind of go into our categories that have a little bit more long-acting or reversible options. So we call these LARCs, or long-acting reversible contraceptive, and that includes things like Nexplanon, which is a bar that's placed in the arm and lasts for 3 years. That can be changed every 3 years, and it's done in the office, as well as IUDs, or intrauterine devices. This ranges between 3 to 10 years of use, and one of the IUDs in this category is a non-hormonal option for patients. These are all progesterone only with the exception of the copper IUD, but they can significantly help with volume control, especially for people who have really heavy periods or want to have less frequent cycles. But they're great for effective birth control because you can't forget to take them. They're a placed device. They're usually placed in an office setting and would require removal in an office setting. Below that kind of category is stuff that is still going to be longer acting, but is really more that you're going to be coming to the office every 3 months for an injection. That's called Depo-Provera. It's a progesterone-only option, and with that, you're getting a shot every 3 months that is going to help suppress ovulation, thin the lining of the uterus, and some people make it to the point where they don't have cycles with that. With all of those things, those are often safe for many patients with other underlying medical conditions like hypertension, blood clot history. These are things that can be used for patients who may have a more complex medical picture where pregnancy is not safe or undesired. Outside of that is going to be more things that each patient has their own control over. So that's things like patches, pills, and rings. The patch is placed once a week, so you change the location, but once a week you're placing a patch. You take that one off in the following week and put a new patch on, typically given for 3 weeks. You'll leave it off to have a period, and you're doing that every week for 3 weeks at a time. Besides that is going to be a ring, and that's usually a rubber ring that looks like a hairband. It's bendable, and you can place it vaginally. You leave it in for 3 weeks. Take it out to have a period and put a new one back in. So these are often good options for patients who are like, I'm not good with taking a daily medication, but I don't really want to have an inserted device. Or I'm not ready to say I'm permanently done having children or don't want children. And then beyond that are things like pills. And pills come in various formulations. There's estrogen-containing birth control pills and progesterone-only birth control pills. And the amount of estrogen and progesterone and types of progesterone is really what helps us decide how frequent you're going to have a cycle and what helps with ovulation suppression. As far as how birth control works, it just depends on the type of method that's used. Some will suppress ovulation, others will thicken cervical mucus, but they all ultimately are used as long as you would like to, with the exception of permanent sterilization. So things that are devices that are inserted, you can actually take out sooner if you decide you want to conceive earlier than the expiration for the device. Outside of that is still things like condoms. Condoms are effective birth control, just have to be used regularly, and these are the only things that are going to prevent against STDs. And then things like spermicides, as well as Phexi, which is a new vaginal insert that is non-hormonal.